Hello. For this persuasive speech, I'm going to be talking about why the U.S. should have a universal healthcare system. The topic of healthcare has always been an issue, and to me, that's something I feel strongly about. There's those that can afford healthcare and choose not to be covered. There's those individuals that are covered yet have ridiculously high premiums and co-payments. And then there's those that are left with debt that they're drowning in because of co-payments. More and more people are unable to afford having healthcare, especially with the high cost of living in San Diego. As it is, to be able to live comfortably in San Diego, you must have a double income household. Depending on the job you have, it might be provided, but with a deduction every month. Healthcare through a job is no good if it costs 1/4 of your paycheck. For example, my mother, she was covered for 27 years through UCSD, as well as my brother and myself, at a very good rate. But once she retired, she couldn't afford paying for healthcare. My stepdad, who was working for a plumbing company at the time, could put her on his plan for an extra $700 a month, and that wasn't including the co-payments she would have for every visit to the doctors or the emergency room or any meds that she wanted to pick up. Because of how much companies wanted to charge her for her to be covered, she chose not to be. She's been without health care for almost 3 years while having asthma and lupus because she decided to pay bills instead. According to the scholarly article, the Affordable Care Act, the Medicaid coverage gap, and Hispanic consumers, a phenomenology of Obamacare, by Sharon Schembri and Suad Gadar, approximately 1/5 of Hispanics remain uninsured relative to 8% of non-Hispanic whites and 12% of non-Hispanic blacks. This shows that the Hispanic community is affected more drastically than any other because they're already living in poverty, so any other bill can send them into more debt. This article also talks about the amount of individuals that were uninsured even after the Affordable Care Act was enacted. The article interviews Hispanics that lived in Texas, one of the states that had opted out of Medicaid expansion. And during these interviews, they found out that even after the Affordable Care Act, these minorities were still uninsured. Each individual talked about how the Affordable Care Act had impacted them directly. Some were uninsured, still to not being able to afford medical coverage. Some were left with extremely high amounts of debt for medical bills. Some lacked technology to be able to access the information about it, and some even lacked education to understand the process. There has been previous attempts for having a universal healthcare system. In 2013, Bernie Sanders tried to propose the American Security Health Act, but was unsuccessful. Then again, in 2017, he proposed the Medicare for All Act, but the concern was always the amount it would cost for the economy, or how much more people would visit the doctors because it would be free of access, therefore raising the economy's spending. If the government provided healthcare to everyone, it would improve public health overall. Especially in light of COVID-19, those that do not have medical coverage could easily be a carrier for the virus, but refuse to get help in fear of the hospital bill afterward. If healthcare was provided, we could tackle this pandemic down more effectively. It would also help the economy. When people have access to healthcare, they have higher chance of being healthy, therefore not missing much of work, resulting in them contributing to the economy. Businesses would also bloom. They would no longer have to pay for employee health insurance policies, allowing for more growth in the business. According to a study from Harvard researchers, there are almost 45,000 deaths annually due to the lack of medical coverage. That's one too many. The Universal Declaration of Human Rights states that everyone has the right to a standard of living adequate for the health and well-being of himself and of his family, including food, clothing, housing, medical care, and necessary social services. But They also forgot to inform us that our right to medical care is taken away if we cannot afford it ourselves. Things that could help fund for universal health care is big businesses getting taxed more and sales tax rate being based on the average household income for the area. For example, I had looked up National City's sales tax rate a few days ago, and it's currently at 8.75%. I was curious about National City because I actually reside in National City. And our average household income is $61,809. While La Jolla, their tax rate is at 7.75%. That's less than National Cities. And they have an average household income of $185,349. That's triple the amount. I think that's ridiculous and it needs to change, and there's definitely a strong need for a universal healthcare system. Thank you.